So when we have patients under the review board, then the bread and butter of the treating team is to assess risk for violence, obviously. And to do a full violence risk assessment, it's usually composed of a interdisciplinary team. So we're highly specialized mental health professionals that have been trained during our university training, such as like we have forensic psychiatrists, criminologists, some specialized forensic nurse, social workers, psychologists, and so on, that have received university training on risk assessment. And we are using scientifically validated tools that go over different risk factors of violence. So there's a method when we assess risk for violence. Moreover, especially when we use those tools, we use this framework on a continuous basis. So sometimes our patients might be higher risk at sometimes. When they get treated, the risk may go down. So we assess risk for violence on a continuously basis, and so that we can provide the interventions appropriately. Obviously, the risk zero doesn't exist. So even when we use scientifically validated tools, there's always sometimes that we miss and that we cannot predict any violence. First of all, when we try to assess a complex behavior such as violence, it's really hard to predict those kind of behaviors. But more importantly, when we do risk assessment, is not so much to assess the risk for violence, but is to make a plan to mitigate this risk of violence. And when we make that plan, obviously we involve loved ones, we involve family members, because they're part of that plan to make sure that the patient doesn't get violent again.